Hi there, welcome to our next practice. What I thought we could do in this practice is do some breathing prep, and we'll use what we've learned from a little bit of the preparation, and we'll involve that in some sort of a short meditation practice, which I think is pretty helpful. So first of all, let's play around with the diaphragm a little bit, the most underused muscle in the body. So you're going to bring the big finger, you're going to stick it together. Just the ends of the fingers kind of touching a little bit very lightly. And what I'm going to invite you to do is to expand the stomach on the in-breath, right? So you could do this one probably, it's kind of easier standing up. I'm just sitting with legs underneath me at the moment, which is a little bit uncomfortable for most people. But from here, just check it out first. So as I breathe in through the nose, out through the mouth. I'm going to attempt to let the fingertips come apart by just using the belly or the diaphragm. So I'm not breathing here first, I'm breathing here first. Alright, so just look at your own belly, touch the ends of that middle finger together. In through the nose, nice big expansion, release the air out through the mouth. Into the belly. Don't worry if this is a struggle. I think half of the people that I work with in meditation and breathwork courses don't really know how to use the diaphragm efficiently, so this requires some practice. And then just relax the hands, give them a little bit of a shake around. You're going to take the hands like this. You place them halfway up your rib cage. If this causes you problems on your thumbs, you can just place your hands here. So it's not like down around your waist, it's a little bit up there. Again, just check it out first. So I'm going to start with the diaphragm, the belly again, right? So as I breathe in, and then expand outwards to the sides, and then and release, and then again into the belly, into the sides, and also not just the sides, but maybe the back of the rib cage as well. You might be able to feel it. So you could close your eyes if you want, you could feel into that. Remember, start with the diaphragm into the belly. Sides of the ribs expanding outwards. Release the out breath. And then just release, shake out the hands a little bit. So diaphragm, ribs, now up into the chest like you're topping something up, like you're filling a bottle up with liquid or something like that. So from the bottom upwards. So for this one, just to open the chest and open the shoulders a little bit, again without kind of straining too much. You can even just kind of touch your fingers like that or interlace them. So as you breathe in again, start at the bottom. So as you go in, up into the chest last, and then release into the belly. Sides of the ribs, top up into the chest. Let the air fall out. Belly, ribs, chest. Full inhalation without straining. And then just release the hands. So it's just to figure out how to use the breathing muscles a little bit more. So now I'm just going to sit down in a normal sort of meditation posture. Again, you could be sitting in a chair, right? However it works for you. Main thing with meditation is to be comfortable in your posture, but spine upright, chest, shoulders open, comfortable, have a little wiggle around, make the base of the body comfortable, and then the spine can rest. Not kind of like this here, like roll up and back. All right, we'll do a little bit of breathing practice together. So we'll use the breathing. I'll talk you through it. Long spine, roll the shoulders up and back. You can leave your hands in your waist if you want together. You can put your hands on your knees, however you want to do it is fine. Most people when they first start meditating, they just close your eyes. So you can close your eyes, you can leave them open or partially open if you want. So first of all, just notice the body in contact with things in quite a simple way. Feel into the body, bum in the seat. Maybe back in the chair, or maybe the spine is unsupported. Wherever the feet, legs, hands are. And let's take a few breaths deeper than normal, in through the nose, out through the mouth. But remember, we're going to attempt to use the diaphragm. So if I say expand the stomach, expand the belly, what I'm really talking about is using the diaphragm. So into the belly, and then just release. So we're exaggerating the breath a little bit. And at the moment we're just concentrating on the first part, right? We could call this 3-part breath practice, so into the belly, into the ribs, into the chest. But let's just start with the diaphragm, since that's a little bit tricky for quite a few people. So breathe in, expand the stomach, little pause, and then just release. Let the air fall out the mouth. And then you arrive in the pause at the end of the out breath. You just rest for a couple of seconds. Breathe in again. And then just return the breath to normal. And if you want, you can move the tongue around the teeth, inside of the mouth a little bit. So this time we're going to breathe into the belly again, but then up into the heart center, around that area. So into the belly, into the heart center, and let go. And we can try now just breathing in and out of the nose. Now on the out breath, We call it Ujjayi breath in yoga. So it's like a little rasping sound, little constriction in the back of the throat. So I'll make it a little bit louder, maybe so you can hear slightly. So as I breathe in, and then you're not actually forcing it out, just letting the air fall out. Even if it doesn't sound loud or anything, just see if you can tap into that. Really, you're tapping into your vagus nerve in that area of the body. Your out breath is more parasympathetic or soothing system, so you let go on the out breath. Into the belly, into the heart, little pause, let go. Now this heart area has been referred to as like the emotional center of the body, where we get stuck in that area. Maybe you've defended your heart in the past and talked about it a lot. See if you can get a bit of a felt sense of it, especially the letting go part. So I breathe into the belly, up into the heart, and then I just let go of anything that I don't need. And again, just breathe in and out of the nose. I'm just kind of sometimes using a little bit of mouth out breath so you can hear it a little bit easier. Now into the belly, into the heart, and then up into the chest, just like a wave. So a little bit, kind of fully in. Belly, heart, chest. Release the out breath. Learn to let go. So into the belly, into the heart, into the chest, but then letting go is the reverse, right? Chest, through the heart, through the stomach or the belly. Let go. Don't overthink it too much. Just kind of play around with it a little bit. Of course, your mind drifts away, it gets distracted, which is perfectly normal. Don't get annoyed with yourself. You just go, okay, I'm distracted, and notice that. Give the thought or the story some space. And then as you breathe in, even you could just notice what you're involved in your head. And then as you breathe out, you can just let it go. You don't have to continue breathing more deeply than normal. You might have already begun to just breathe normally. Still in and out the nose if you can. Still starting with the diaphragm. Now you can imagine, if you want, that there's like a little log jam in a big river or something where the river narrows, which could kind of be your heart center, you're stuck, your emotions are a little bit blocked and things. So at the top part of your chest, a load of water comes barreling through the heart center, clears the blockage, just flushes it out through the stomach. So as you breathe in, and then just breathe out, let the chest relax through the heart, through the stomach, all the way to the end of the out breath, and then just rest. So if you can genuinely let go all across the out breath, through the chest, through the heart, through the stomach, and then arrive in that pause and rest for a few seconds before you breathe in again. So as you move towards the end of the practice, you've increased your cardiovascular health, which is directly related to your longevity. So you're improving your breathing mechanics using your diaphragm. So there's a physiological bonus. And also you're learning how to use the breath to soothe the physiology down, especially on the out breath, learning to let go in the body, let go in the mind. And then you could use your breath work as a meditation support, obviously. Learn to rest, maybe resting initially in the pauses at the end of the out breaths. A little move around. So there you go. Enjoy your practice. Take care of yourself.